The second 30-credit module is titled Managing Effective Practice Learning Environments. The idea is that it slots onto the first module but considers some more skills that the practice educator may find helpful alongside teaching theory. Let's have a look at what exactly it entails. So, Module 2 aims to consider the practice educator within the UK healthcare environment and consider the additional roles a practice educator is often required to take on alongside that of the teacher. Within this module, we consider leadership theories and change management, as alongside teaching learners, practice educators are often required to understand people management and should be encouraged to enact change within their specialty. Another area that is growing for the practice educator is that of pastoral support. This is support for the learners, which can range from simple issues to those more complex. Typically, practice educators learn about pastoral support as they grow within the job, but this can have an impact on their mental load. So we've made pastoral support a key part of our curriculum to help practice educators to feel empowered when helping learners, and not just to be a one-stop shop, but by understanding who and when to pass over pastoral concerns to. Finally, this module considers the NHS and UK healthcare environment and its unique nuances and takes a critical eye to current practice with the hope and aim to improve education for all. On the slides you can see the indicative content, which gives you just exactly what we're going to be covering within the module. The assessment for this module is a single small-scale research inquiry of 5,000 words, which can be on any area that the learner chooses, but should focus on implementing a change within their clinical learning environment. This has been designed considering the idea of authentic assessment, which looks at using methods of assessment to help learners with tasks they may encounter within their job. The small-scale research inquiry aims to help learners with the idea of service improvement, which often requires written justification within the NHS. Through writing the 5,000-word essay, learners should develop cohesive arguments, which could then be utilised within workplace to argue for change. It could also draw together all of the learning for the whole course. Through providing a written final assessment, we've also allowed for there to be flexibility for our learners, should work, life and study not always be balanced. Now let's have a look at the course delivery. So, throughout the design of the course, we've been driven by the ethos of less is more, ensuring that we make each interaction with our learners matter whilst allowing time for consolidation of learning. We're aware that our learners will be working alongside this qualification and that this has really been at the forefront of our minds when considering the course structure. As such, we've utilised a mix of face-to-face and online learning to try and capture engagement and to ensure that learners are not having to juggle postgraduate study, work and their own personal commitments. The University of Suffolk utilises the block and blend approach for learning, which means that the course takes on a block structure with 2 core modules delivered in blocks of 30 credits each. The first block starts in November and runs for a total of 7 weeks, with a time after the block for completion and submission of assessments. And this block is when Module 1 is delivered. The second block starts in March and runs again for a total of 7 weeks, with time after the block for the completion and submission of assessments. And this aligns with Module 2. Both blocks have been planned around holidays, with the first block finishing before Christmas, and with the second block containing a break in teaching for 2 weeks to allow for the Easter holidays. These have been included to accommodate potential staffing or personal requirements during this time. Okay, so now let's look at the academic and non-academic requirements for those of you wishing to join us on this postgraduate certificate. The academic requirements are a minimum of a 2-2 in the relevant subject, with a current regulatory body registration. Alongside our academic requirements are some non-academic requirements, which are that you are able to provide a reference from your current employer, and this should include confirmation of your status in a current practice education role or evidence of your work towards one. You must have an opportunity to engage in learning, teaching and assessment of students in some capacity, as this helps with the submission of assignments throughout the course. If you have any questions or queries about the entry requirements or anything at all that's been mentioned in this brief video, then you can contact the course team. Their information can be found on the next slide. Thank you for listening to this brief course video. And if you do have any questions or queries, please do feel free to get in contact with either myself or Zoe via the emails shown on the slide. And we look forward to seeing some of you on our course in the future. Thank you.